Hello, my name is DeAndrea Bolden. I am from Kalamazoo, Michigan. I'm here at the 53rd Annual Legislative Conference for the Congressional Black Caucus. And so today on this podcast episode, I'm going to be talking about the intersection of politics, Black holistic health, and Black maternal health. And so, quickly, want to give you guys a definition for those that are listening. I never like to assume that people know. And so, maternal health is defined as the health of a woman during pregnancy, childbirth, and postpartum. And so every stage from, conception all the way to after the baby is born, this is what is considered maternal health. And so I want to give you guys some statistics for maternal health. Um, so in 2022, the maternal mortality rate for Black women was 14.4 deaths per 100,000 live births for women under 25, 21.1 for women ages 25 to 39, and then 87.1 for women age 40 and older. The infant mortality rate for non-Hispanic Black women was 10.6. Some of the things that are considered as factors for Black maternal health disparities are racism, implicit bias, and then I also saw access to maternal like maternity leave and things like that, because some people do not have jobs that provide those type of benefits. Some other important stats to know about maternal health is that more than 80% of pregnancy related deaths are preventable. Black women are 3 times more likely to die from pregnancy related causes than white women. In 2022, the rate was 49.5 deaths for every 100,000 live births, compared to 22 for every 100,000 live births for the general population. And so this topic is very, very important to me as someone that is a mother. I have 2 children, and I had 2 very, very traumatic pregnancies. My first pregnancy ended with placenta abruption, and this is when the placenta pulls all the way from the uterus, and it can be life threatening for the child and for the mother. And so I went into labor probably about 6 or 7 weeks before the baby was due, and I started having a lot of bleeding and a lot of blood clotting. I didn't know what was going on. They realized that the placenta was pulling away from the uterus, the wall of the uterus, and eventually I ended up going into labor, and the doctor thought it was a good idea to give me Pitocin. Anybody that is familiar with Pitocin during childbirth knows that it makes the contractions stronger. And so what happened was the contractions got so strong that it caused the placenta to come all the way off, and they were worried because the baby's heart rate died, or not died, the baby's heart rate dropped, and they were worried about her being able to get oxygen. Now, thankfully, my daughter, who's now almost 21, she did survive, and she's perfectly fine. But that was a very, very scary situation, and an example of some of the things we go through as Black women giving birth to children. Then I believe it was 7 or 8 years later, me and my husband were pregnant with our son, and that was a very, very, also a very traumatic pregnancy and a very traumatic experience. And so I do believe a lot of things are preventable, simply because a lot of times as Black women, we're ignored. A lot of the things that we're describing to the practitioners and the physicians, they're not usually, sometimes they don't listen, or they minimize what we're saying, or they feel that it's not really a big deal when it is a big deal. And so as far as from a political standpoint, I think it's important when we see that the rates of Black maternal mortality rates and infant mortality rates amongst Black children is higher than the general population. I think it's important that government officials and different agencies get involved to find solutions to help figure out why this is happening. And so to say that, we believe racism and implicit bias and different things are the reason why, then you have to begin to ask, okay, what is the solution? What are we going to do? What is the plan to get these things under control? And so I think one thing that is important is that Black women have to learn how to advocate for themselves. I can say for myself that when I didn't know better, and especially when I was younger, you can be intimidated sometimes by healthcare professionals. But you do have to realize that anybody that you see that's giving you a bill and you have to pay, such as going to the doctor, that means they work for you. And so I always suggest to people to shop around. If you don't like the care you're getting, find a different provider, find a different doctor, find someone that's more compassionate, find someone that is going to meet your standards and your expectations. A lot of times, when we're disappointed with our healthcare providers, sometimes we have not expressed our expectations. And so it's important that we express our expectations, our needs, and what we expect as Black mothers, expecting children, or just people in general. When we're talking about just Black holistic health, it's important to understand that you can find another practitioner. If you don't like what one doctor is saying, find another. But another thing I think that is important to look at is what can be done, as far as legislation, so that women in general are able to get time off their jobs. What happens when so many women are working jobs that don't allow them to take time off, or if they do take time off, it's unpaid. And so a lot of women work to the last minute. They go back to work faster than a doctor would typically like or see women go back to work, simply because they have to pay the bills. They don't have any support. They don't have any help. They don't want to lose their housing and or their cars and other things like that. And so I think it's important that we when we talk about solutions, that we think about political strategies and political initiatives to make sure that all women have equal access to maternity leave where they're paid. I think it's also important that we look at efforts to make sure that we eliminate implicit bias and racism in healthcare. To keep talking about these things, to see all these peer-reviewed studies and peer-reviewed articles and all this data and information that proves that there's racism and implicit bias in healthcare, but not do anything about it, is pretty asinine. And so I think it's time that we start putting fire to our feet and boots to glutes, so that we can start seeing change in that area. And so, again, this is just, talking about maternal health is just so important to me because of my own story and my own experiences. And so, even after the situation with the pregnancy with my daughter, when I got pregnant with my son, I didn't even know. So I talked about how that pregnancy ended. I forgot to mention that she was born by emergency C-section. And what happened was, trying to think what happened after, it wasn't until I was pregnant with my son that I found out that that pregnancy ended due to placenta abruption. No one even told me. Nobody bothered to tell me why the baby's heart rate dropped. No one bothered to give me any information or explain, what happened or what was going on. And so I didn't find that out until I had my son. But because of that pregnancy and what happened and everything I went through, unfortunately, I was automatically considered high risk my next pregnancy. And so with that pregnancy, I ended up having to go to a lot of specialists, a lot of high care physicians and different things like that, to try to get better care, because I was considered high risk with that second pregnancy. And that pregnancy, I had so many complications. And unfortunately, it ended with the doctor asking my husband, did they want him to save me or the baby? And thankfully, thank to God, me and my son both survived that pregnancy. But it was a very, very traumatic pregnancy. It was a very traumatic experience. And it's something that I feel like a lot of it was preventable if the doctors would have listened to a lot of my requests, a lot of the things I was saying. And that was why I mentioned earlier that I feel like a lot of times Black women are ignored. And a lot of times our concerns are minimized when it comes to our care when we are pregnant, and whether it's pregnancy, going through childbirth, or even postpartum. I've seen so many stories. We saw the story about Serena Williams, about how she said she felt like she experienced racism after the birth of her child and how they treated her and how she was mishandled. We seen how a very famous judge, her daughter-in-law died after child labor, and they believe it was preventable because she bled to death. And when they were trying to get help for her, they were ignored. And so there are countless stories about Black mothers dying during childbirth or even after childbirth, only to find out it was preventable. There have been so many stories about how Black infants are dying in the womb, or during childbirth or shortly thereafter, only to hear once again that it was all preventable. And so I think that this is a very, very important topic. I love to see all the efforts and all the different organizations and the different initiatives and push around the country to really highlight Black maternal health. And so now that we have all this data, now that we have all these stories, and now that we have all this information, it's time for us to actually do something. And so I'm hoping that even being at this this great event with all these political figures and senators and representatives and different people and politics and different people of influence, with them all coming together, I'm really hoping that Black maternal health is a topic not just of discussion but for solutions, um, because this is just a very, really, really, really important topic. Yeah. Okay. Okay. One more. Okay. All right. Is that good? Okay. Okay. All right. Yeah. Okay. Okay. All right. Good morning. Good morning. How are you? Rough start. Ready? All right. I am back. It's me, DeAndrea Bolden, and I am back with Dr. Leandra James. I'm going to allow her to introduce herself, and then we're going to jump right back into the topic.
Sure. So I'm Dr. Lindra James. I'm a DNP RN. I've been a nurse for over 22 years, and I've worked in many different areas of healthcare. So I worked across the country and worked my way up to nursing leadership, and achieved my doctor of nursing practice degree, and decided to write a book, right, called Confessions of a Nurse Executive: The Conscious and Unconscious Bias in Healthcare. And in the topic that you're discussing today, it really hits home when you talk about bias, right? Because some of the underlying issues that we see or that you're seeing in healthcare, a lot of it stems from bias. But I'll go ahead and I'll let you, go back into your conversation that you were having so that we can really get into the topic at hand.
So what was covered already, I gave a definition for maternal health, and then I gave some statistics about Black maternal health, Black maternal mortality rate, and also the infant mortality rate. And then I started sharing my own stories about what I went through being a mother of two, and how my first pregnancy ended in placenta abruption, and the second one ended with the doctors asking my husband which one to save, and just how I felt that I was ignored. A lot of the things I was saying were minimized. And one thing I like, when I looked up the some of the factors they were talking about for issues with Black maternal health, one of them was talking about racism, implicit bias, and then they talked about maternity leave. But I think another thing that matters is insurance, because I believe they said 80% of people that have, I think it was Black maternal mortality, think it was 80% were on government assistance. I have to look that back up. I think I have it on my phone. But the reason that mattered to me is because when I had my first child, I was in my 20s but younger, and I was on government insurance. But this crazy thing, and I was single. But the second time I was married, I had private insurance, and I still got garbage treatment. So I wanted to highlight that because a lot of people think that it's all about social economic status. But if that was the case, we wouldn't hear stories like Serena Williams. We wouldn't hear stories like, I believe it was Judge Glenda Hatchett's daughter-in-law that passed away. We wouldn't hear those stories if it was all about how much money a person has or doesn't have. And so, yeah, I want you to just kind of chime in and talk about some of the things you've seen as a nurse in the trenches for 22 years.
Right, absolutely. I actually share a personal story myself. So my brother has an 8-year-old son now, and his wife actually suffered she had a preeclampsia, and she ended up having a stroke. And she lived for about a year. I won't go all into it. She lived for about a year, and then she passed away. And some of the things that sometimes we just don't know. And when I look back, hindsight is 2020, and my brother didn't know the questions to ask at the time at what was going on. But when he shared with me the conversations that was happening, and this was we were in different states.
Yeah.
He was in North Carolina, I was in New Jersey or Pennsylvania at the time, actually. And, so a lot of the conversations were, through him. So I'm trying to get information from him and trying to tell him the questions to ask. But again, as laymen, we don't know the questions to ask. And that's what happens a lot of times with our community. They don't know the questions to ask.
Very true.
And as a healthcare professional and as someone who's worked in executive leadership, I've seen firsthand the bias that occurs at the top. And what happens is it trickles down into our communities.
Yeah.
So not only does it affect leadership, it affects our staff, it affects our leadership staff, it affects the staff, and then it affects our patients, right? So if you have the same people at certain levels making decisions and we're not diversifying those leadership teams, we're not getting that diversified opinion that we need to make the decisions that we need to be made for certain communities. Hence why we have so many disparities and inequities within the healthcare system. And we don't think about that but we don't know when we're not educated. So to your point, that's why it's great to have events like this so that we can start getting the word out to our community so that they know the questions to ask and that they know, who they can trust, because there's such a mistrust with the healthcare system now.
That's a whole nother conversation.
Exactly.
Yeah.
Exactly. But this is why, and a lot of it stems from bias, unfortunately, to your point. And it's very unfortunate. And to your point, and going back to my brother's situation and his wife, they had great insurance. So a lot of times it's not about, us having, the best insurance. They had great insurance. My brother worked, his wife worked, they had great insurance. So it wasn't that they couldn't pay. So it's unfortunate that we see it not only in situations where people are able to pay but we absolutely see it in areas where, in our marginalized communities. Unfortunately, we really, really, really see it. You see it all the time.
That's good. I kind of want to shift a little bit and go back to what you were saying, because looking at Black health from a more broader perspective, let's talk about just in general how a lot of African Americans, just Black people in general, don't know how to advocate for themselves in healthcare. And that's why I was saying, and I have been always telling people, if your provider works for you, they are paid, they are on the job. You don't have to be intimidated by them. If you don't gel with them, or you feel like they're not giving you the care that you want, or you're not heard, find another one. If they give you a diagnosis and you're not sure, get a second opinion, get a third if you have to. I have some very dear friends that were told basically that their child was going to die in the womb and to abort the baby. The baby is alive and well because they got a third and fourth opinion. And so it's nothing wrong with being thorough when it comes to your health, your livelihood, the health of your children. We have to learn. And one thing I find in the community, I love my people, but we are so prone to draw to pseudoscience and scams. Like there's a guy, I won't give his name because I don't want people following him, But he was giving out some terrible information. I said, if anybody was versed in science just a little bit, they would be able to refute that. But when you don't know anything about biology, anatomy, the human body, medicine, anything like that, they're easy to be deceived. And that's what I don't like. And especially when our health, the state of our health is typically worse than other groups. Our life expectancy is typically lower than other groups. We are the last people that have time for scams, gimmicks, teas, and potions. And I have no problem with tea. I drink tea all the time. But I'm just saying that a lot of people don't realize they're being scammed by people that are just trying to sell them this random stuff. They don't know what it is. I've heard stories about people dying. There was a guy that was telling people he was a doctor. He was not. He was telling people to stop taking their medication for diabetes. And I believe 2 people died. Why is that dangerous? Because if you're not a physician, first of all, you have no authority to tell people not to take their medication. You have no authority to prescribe anything, nor diagnose or treat anyone. And if you don't know a person's baseline health, other health issues, other risk factors, you don't know what's going on in their body, you can give them something that can interact with medication. You can give them something that can exacerbate symptoms. I can just go on because people they don't know. And I understand that a lot of times people want to be healthier, but we go about it the wrong way. And so I try to be careful when I say holistic health. I have to let people know I'm rooted in science. I have a master's in medical sciences. And so I'm not coming with gimmicks and stuff. I'm going to give you some science, but I'm also going to give you some practical things that can help, like exercising,
Right.
eating clean,
Right.
staying hydrated.
Right.
Taking care of yourself, reducing your stress load. Stress is a silent killer. So many things, but I want you to speak to that and talk about that. I want you to talk a little bit more about how people can learn how to advocate for themselves. That's something I didn't know how to do with either of my pregnancies. See, now I'm more educated, I'm more informed, I'm more aware, I'm older.
Right.
I can see through this stuff. I had just recently, I had a loved one that was in the hospital, and their blood pressure had got up to 195 over 136 or something crazy like that. I'm watching it every time the nurse comes in, it's going up, and the doctor's like, "Well, I'm going to give this, your loved one some medication, and as long as her blood pressure goes down in 2 hours, she can be released." And I said, okay, well, what medication are you releasing her with? Well, just X, Y, and Z. I said, okay, that's a steroid. What are you going to do for the blood pressure? I said, if you're going to take the steroids, because the person was taking 500 milligrams of the steroid, the doctor was reducing it to 40% to 40 milligrams. I said, if you take her medicine down all that way, you don't know if she's going to rebound with everything else that was happening with her body. And how is she going to control the blood pressure? He turned around and gave her that blood pressure medicine. I called him in the hallway, and I professionally and politely told him off and told him there's no way you're sending somebody with stroke level blood pressure home with no blood pressure medication. Does that make sense? So I want you to talk about that. I want you to talk about how people can advocate for themselves, what to look out for, things like that.
Right. What you did. Right. That's the biggest way you can advocate for yourself is speaking up. I can remember working in the emergency room, and this was years ago, and I want to say I got in trouble, right, air quotes, for advocating for a patient. I could understand, like, we're going to send her home. I rechecked the blood pressure, after we gave the blood pressure medicine and the medication went down, and I rechecked the blood pressure and the pressure went back up. And the doctor, the ER doc, got mad at me because, why did you recheck the blood pressure? Well, because I thought that was the prudent thing to do, right? So you're going to have nurses who are going to advocate for you, However, you have to advocate for yourself.
Yeah.
And part of the issue is sometimes we don't always know the questions to ask, but we have something called intuition. That when we know a fit, but sometimes we just have this feeling where, well, that's the doctor and he's right? Because even as a nurse, like I walk in, to a patient's room, and the doctor can walk out and tell them something completely wrong, and because it came from the doctor, there's a perception that it's right.
Very true.
Right. So,
doctors can be wrong.
They absolutely, listen, no one's perfect.
No one.
No one's
That's very
perfect.
true.
The biggest thing you can do if you know something isn't right, and this is why family members like to be present when
Yes.
when their family members are in the hospital, because they, because a lot of times, especially when we have our old, I have a mother in her 70s, and she may not, know the questions to ask, and she doesn't know the questions to ask. However, because we know that, if I'm a mother, if I'm a daughter, or if I'm the son, or if I'm a niece or a nephew, I know that I have to advocate and ask those right questions for my loved one. And again, I'm gonna share another personal story. My mother had a physician who, now she's had a daughter who was a nurse, right? But she had a physician who, he actually took over the practice for another doctor. The doctor had took care of her for years, and he took over the practice for another doctor. And that doctor, so he would just give her medications for her blood pressure, just send her home, just give her medications, give her sample medications. And I was her daughter, and she trusted that doctor so much. And I would say, "Ma, this isn't right.
Yeah.
You need to be going for echoes. You need to be checking your Dopplers." I actually paid for these things out of pocket so that she can get them done. Sent him the results. My mother actually ended up in the hospital with a pacemaker, right? Like, and I'm just condensing the story. Every story has its different intricate parts, right? And I'm condensing the story. She ended up in the hospital with the pacemaker. However, it was me advocating for her, right? It's what got her to the hospital so that she can get that pacemaker she needed. And they bought her another, at least she's had the pacemaker now for 20 years. She's on her second pacemaker. So I say all this to say the best thing that we can do when it comes to our healthcare system is advocate for ourselves and educate ourselves. If we have and when you say educate ourselves, you have to be careful who you're choosing to educate you.
Right.
I myself, I own a wellness business, right? I'm a healthcare professional.
Yes.
I am certified. I have degrees behind my name. And I've been doing this for over 2 decades. That's who you want to trust. You want to trust someone who's a licensed professional. Be careful who you're, Google, YouTube University and Google. You cannot treat yourself or your symptoms.
Self-diagnosing.
Right.
Can we stop that in 2024?
We have to stop self-diagnosing. We used to say Google was the healthcare professional's worst enemy because, you would be trying to educate our patients in the hospital, and they looked up something on Google, and Google told them X, Y. Wikipedia is the worst. And excuse me if I'm being censored here, but, we do have to stop trying to self-diagnose. You have to let the healthcare professionals do that, but you have to also find someone you trust. And having that trust and that energy, you if it doesn't fit, it doesn't fit. You have to find the person who's relatable to you, who you feel understands you. And it's unfortunate that in our Black and brown communities, we don't always have healthcare professionals readily available to us who's relatable, and that's where that mistrust comes into play. So being able to advocate for yourself, being able to trust your healthcare provider, and contacting a healthcare provider who is a licensed professional. And you mentioned holistic before. When someone says holistic, still do your research. What type of certifications, how are they holistic? What type of holistic medicine are they giving you?
Well,
are they providing, right?
I think one thing about it is wellness and holistic health has kind of been hijacked by people that lead with spirituality first, and it's causing it to become a dumping ground, and it's becoming very muddied and very messy. Holistic health literally should just be dealing with your total health. Everything that's impacting your health should matter. And so there's a push right now, and there's research and statistics that are backing that people want more integrative services. They're pushing and leaning more towards functional medicine, preventative care, doctors that are doing more basically than just treating symptoms and handing out pills. It's like, is there something else I can do that can help me out? Are there other factors? Are there lifestyle factors? Are there other things that could be driving the cause or the etiology of what is happening with my health? And so I'm very big on that. And so I always, that's why I what she said is very true. So just make sure that, people, when it comes to your health, you should be going to healthcare professionals. If it's mental health, you should be going to mental health professionals. I also have a master's in counseling. And so it's important that you go to people that have academia from accredited schools,
Yes.
and have the credentials and different things like that. So it's just, yeah, everything you said was on point. There was one more thing I wanted to touch on, and it's people have to learn how to go through their charts and go through their, I don't know if you teach people how to understand how to look at their blood work, how to look at their lab results, how to understand that. I was talking to a lady, she's a medical doctor, and she was telling me, basically, and it's true, that you can have lab results that are out of range, like something can be low or high, and the doctors won't do anything until it reaches a threshold where they have to treat. So basically, I'm going to leave this here until you get sick enough for me to give you medication. And so I want to talk about that so that people can recognize, if you see things that don't are looking wonky, if you see things that are out of spec, or say, or out of range, or but not at an action level, or not at a threshold to treat, not at a place where they will actually diagnose. A big one she talked about was pre-diabetes. She said there is no pre-diabetes. It's just diabetes. She said, but they don't do anything until it gets to a certain point. And so I want you to talk about anything you do to help people learn how to look at that stuff, because I'm always like, whenever people are in the hospital, I'm always like, I need to see the blood work. How do the kidneys look? Because kidneys is life. And a lot of people don't understand. I've had to tell, like, somebody has issues with their kidneys, and I said, why would the doctor keep giving you MRIs with contrast, knowing that that can damage or cause, like, have a negative impact on their kidneys? And so I want you to talk about how people can look at all those lab results and look at that stuff and know what to do. And if that's a service you offer, how can they find you to get that information?
Right. So that's a great question. Most organizations, hospitals and such, they have different apps,
Yes.
whether it's called MyChart.
MyChart.
Yep. So they have different apps where you can actually receive your results, your lab results, radiology results, and sometimes you have access to these before the doctors do.
Yes.
And we have to start being more proactive in reading those results. Now, you may not understand them, and that's where your healthcare professional comes in. But the one thing that you do want to do is it gives you, it's very simple. It'll show you what's out of range and what's in range.
Yes.
Now, sometimes it may be out of range by 1 decimal, which we probably won't do anything about, right? And however, in advocating for yourself, going back to advocating,
Yes.
right? We need to start, because a lot of times, we discharge patients, we say, hey, this is, and I'm just using MyChart as an example. This is MyChart. Make sure you sign up for it. And when patients are discharged, sometimes they're just looking to go home, and they go and they pick up their prescriptions, and the MyChart is an afterthought. So we've never signed up for that app that can show us our lab results,
Yes.
that can show us those radiology results,
Yep.
right? That can give us those reports. And the reports, sometimes it gets a little tricky because you may not understand the wording that's there, but that's when you have to advocate for yourself and call your doctor's office and say, hey, I got this report back and it says that my hemoglobin is 6, right? Or it says that my hemoglobin is 9,
Yeah.
but that's out of range for,
Yes.
for you, or that's out of range according to the lab results. Now, depending on your provider, depending on how your provider, what they know about you, because again, this is where that relationship building comes into play, right? Your provider should know you well enough to know whether or not that's normal or whether or not it's in range.
Uh-huh.
So in doing that, and a lot of times you have to bring it to their attention, because as I mentioned before, you may get these results before your physician or your provider get the results. So now that you've brought it to the attention, now you want to know, what are they going to do about it? And then you come up with a plan with your provider, because your provider may say, so if, for example, vitamin D is something that I offer, because a lot of us are vitamin D deficient.
Yes.
And vitamin D is good for what? Your immune system, your bones, right? Your health. So vitamin D is a deficiency that a lot of us, especially if we're not from the South, from Florida, California, we're not from areas where we get a lot of sun.
Yeah.
And that's a service that I offer. That's one of the services that I offer. I offer weight loss services, right? Because obesity, right? The hypertension, the diabetes, right? It's It's killing our society. It's
Yeah.
killing our community. And we want to prevent those measures. And so with the vitamin D level, and I'm going to give the example for vitamin D. I had a client recently. We did her vitamin D levels. And you know what? So when we let her know this is what your vitamin D level is, and this is our recommendation. Your recommendation is to have, in her vitamin D level, I think it was 20, right? So we recommended that you get the 50,000 IUs, every week for a month, and then we're going to go and you get it once a month. Then you're going to get it once a month for 3 months. But we came up with a plan, right? That's pretty much the bottom line, and that's what you want. You want your provider to come up with a plan for you and help you to reach your results. It starts with you, or if you're the caregiver, right? Make sure you're reading those reports and learn how to read those apps. And if you don't know, you should make a consultation with your provider, right? Or if you have
go over those results,
go over those
concerns.
Go over those concerns. It really starts with you. And I don't mean to kind of keep pushing it back to you, but it does.
We have to have an effort. We have to put effort into our own house.
Absolutely, because we, and I think it's human nature. We want to point the finger, right? Well, the doctor didn't tell me this, or the nurse didn't tell me this. And again, yes, keeping in mind, we don't always know the questions to ask. However, what am I not asking? What is there that I need to know? Is there anything else that I need to know? Is there anything that I'm not asking that I should ask? That's how we start advocating for ourselves. So looking at those apps, looking at those lab results. If we don't understand something, if everything looks in normal, okay, great.
Yeah.
But if we see anything that's out, we don't know what that means. If it's out of range, call your physician. Or if you had a radiology report and it's saying things that you don't understand, I got the radiology report. When is the physician or provider going to speak with me and let me know what this means? That's what we have to really start doing.
That's really, really good.
Oh, and as far as finding me, so my business is Premier Infusions and Wellness. We offer IV hydration vitamin therapy, and we also weight loss services as well, and we also consultations for the community for concerns with their health.
Awesome. And so again, my name is Deandra Bolden, and I've been on live with Dr. Lindra James.
Lindra James, sorry.